think I need to change my shirt. Stuart, I have made you a co-host. If you have something you want to share on screen, you can share it.
Okay. Yeah, no, I don't have anything currently at the time, but thank you.
Ellen, make me a co-host just in case I need to jump in and share something, okay?
Sure. Okay. Oops. I think I made my thing moved and I made Cynthia Ann.
You have it on? Can you help me, please? I don't-
Honey, you
Why don't I just open it up to the meeting? We have 15 people now coming in. Welcome. This is the FSOMA Town Hall. We have Stuart Shipe here, David Bibby, and a lot of us. I'm not sure why I can't see more people, but
Real nice.
I'm
Open their eyes. Just listening to your voice.
If you can mute yourself unless you're going to be talking to the meeting, that is helpful. Okay, Stuart, I'm sorry, I muted everybody. Hi, I'm Ellen Teeter. I'm the Executive Director of FSOMA, and here's Stuart Shipe, the President, and he'll have a presentation and then we'll have other people talking. So. Nope, don't hear you yet, Stuart. Hold on.
Let me do this. Is that better? Yep.
That's good.
All right. Well, welcome everyone. Good afternoon. I'm Dr. Stuart Shipe, and I'm your president in FSOMA. And I welcome you to the town hall meeting. I've always been very observant that everyone should get a voice as far as our association. We don't manage as FSOMA with a small group of people making decisions for the masses. I would rather have the masses making decisions for the masses. And so I really do appreciate you being present today for this town hall meeting. Hopefully it'll answer questions for you that you may have about what we have going on with FSOMA, and also other resources for you as an acupuncture physician, bigger and broader pictures like what is going on a national level with our parent corporation, the ASA, and also in other venues like insurance and advocacy. We have an entire board here. I believe we should have most of the entire board of FSOMA here to answer your questions specifically related to topics moving forward. Been a lot of chatter about this upcoming legislative session that we have that's being led by David Bibby, doing a great job in organizing that. I can let him speak here in a minute on any updates, but always know that FSOMA is trying to constantly get this information to you. So it's currently on our website. Our executive director keeps that updated, and our publications director as well, to make sure that you're well informed all the time. You can also, we put it out in emails. Natalia is really amazing at trying to get these monthly, and I believe it was bi-monthly at e-newsletters out to you about keeping you updated on all these events as well. So watch your emails, please. Don't let those go into the spam box, and mark it as a favorite so that you can keep current. I have had previous comments come to the board about the board not staying abreast or keeping the members abreast of its activities. And I don't know how we can potentially, I'm sure there's other ways how we can even step up to that task, but we're doing the best job that we can in keeping you informed and currently proceeding with this town hall meeting. It is timely. The reason I actually asked the board to have this meeting is because we are about ready to go into a legislative session, and our current practice of acupuncture currently governed mostly by rules. We haven't had a statute change in many, many years, and it's due. So all of those that have donated in previous last year, this year, in previous years, thank you so much for keeping the momentum of FSOMA going. Because without you, we couldn't do it. Without donations, we do have funding coming in from our conferences, of course, but our main ask of you to donate toward anything that you can give toward FSOMA is always welcome and appreciated. If you can't donate, and there's a lot of folks that are having struggles, there's a lot of acupuncturists that are thriving, but some of us aren't thriving as much as we would like to. And certainly whatever you can give, we don't ask for a certain amount of money. And if you can't give, we know that your time is valuable. And if you would donate some of your time, we have many committees that would operate so much more efficiently if we had additional membership step up. And you don't have to step up into a director, but we certainly would love that on the board, but at least step up into a position of membership, see what we're all about and what we do behind the scenes, so to speak. And I think you'd really be surprised how active FSOMA is. I'm actually very proud, I believe, not only to be the premier conference in the entire nation for Oriental medicine and acupuncture, but also as an association, we get a lot of stuff done. And it's because we have a board that's really engaged and very aware that if we don't step up, literally, this profession will suffer in the future. And I don't ever want to see that happen. So any of you that would like to become a member of any of the committees, I'll have further on in this town hall, I'll have information on how you can do that to go directly onto the FSOMA website and sign up. And then we'll get you vetted and get you placed to your liking where you have affinity for a specific committee, and we can have that happen. So, and Ellen, I know that there's a place on the website to have that happen. Can you allude to that or tell them about that? You're muted. I can't hear you.
Yeah, let me share my screen. I'll just show where on the website you can do it. Here we've got the homepage, and members need to log in. If you want to be on a committee, you do need to be a member. But if you go to the About button and committees, you'll go to the committee page. It gives you all sorts of information about how we make decisions, about what the committees do. And then you can click on this button and volunteer to be on a committee. And we get sent the form. Somebody will call and talk to you, figure out, the best place for your talents and abilities. And, you can try on a couple of committees for a meeting and see which one seems to fit the best to you, but also you'll find out more about what they're doing. So,
Thank
and
you.
if you have questions, feel free to email me, call me, or our contact information's on the website.
So we do have, I do want to stick to the agenda and keep things moving for sure. And I appreciate everyone allowing me to just say a couple of words. We do have, by the by, we do have most of the committee chairs present in this town hall meeting. So if you have specific questions regarding, I see like advocacy or insurance, legislative, so what, they'll be here to answer your questions. So moving forward, I'm going to stick to the agenda really quick and move forward into our efforts as far this year legislatively. And David Bibby has been really effective at trying to test the water, so to speak, with making sure that all the legislators are contacted, know about what's going on. So I'm going to turn it over. Do you mind, David, just giving us a couple of words about where we are in that process? I know that legislative session is about ready to begin. And the last we heard, all of our proposed draft was still in the draft committee. And so give us an update from there, if you could.
Thank you, Stuart. I appreciate it. The Senate and House draft offices both have our language, and we're on schedule and on time with that. They have until February 27th to sort of polish and finish the draft version of those bills. And so I guess I quickly mention that, as a part of the process, you might be familiar with, if you're proposing a bill or an amendment to any statute, you need to have a sponsor in the House and a sponsor in the Senate. And so our Senate sponsor is secured and they filed the draft. We're still working with House leadership to see who's going to carry the ball for us there. But again, we're well within the time frame for this process, and everything is moving along pretty well. I think from a material standpoint, a lot of times we want to know, well, what's new and what's being changed. We really wanted, when I say we, FSOMA and the legislative committee and our attorneys and the people that, you know, have input on this, really wanted to look at areas where language that impacts our day-to-day practice, the things that are inconsistent with our training, inconsistent with the contemporary delivery of acupuncture services in Florida, and also things that may not exist in our statute that are common and accepted elsewhere. And so we want to make sure that our scope of practice is robust and that it's equal to our knowledge, skills, and abilities in terms of training and education. And so the areas of emphasis that we wanted to focus on, I'm just going to show a quick document rather than getting to the details of the bill itself. Let me, if you don't mind, just share real quickly this right here. And Stuart, can you see the
Yeah, we have it.
the document? Okay, so it's a summary. This is in part a summary of what we're attempting, and it's also a legislative education piece where we can kind of distill the broad themes into something that is pretty digestible. And here, the purpose of these changes are to modernize Florida's acupuncture regulation by updating the Practice Act to reflect current standards of acupuncture practices in the state of Florida and update any necessary terminology. And here, the bill simply replaces the term Chinese and Oriental with Eastern medicine, which is a typical state-to-state update that we've seen. It provides an accurate definition for Eastern medicine and practice of acupuncture. It requires supervisor liability for any direct supervision that's permitted in our practice. It provides exemptions for guest instructors teaching at board-approved continuing education courses. Again, this is common across both acupuncture, but any profession that provides CEUs. Updates the Practice Act to reflect current practices and standards here in Florida, and a reminder that none of the changes that we're requesting permit a new act that is currently prohibited under law. And so we have things that are not explicitly permitted, but at the same time, we're focusing on things that are not prohibited. And that's an important distinction. We're not asking the legislature to reverse any action that in existing language is prohibited. And so the point here is that we have some gray areas of practice and or omissions of things in practice that would be helpful if we had. And those, starting with inclusion of patient evaluation and management, that terminology is important for treatment services. And our explanation here to be helpful is adding evaluation and management as included in acupuncture treatment services, because many payers will not reimburse for these services because the particular terms are not included. In states where these terms are included, payers reimburse. Simply stated, we're required to do evaluation and management services, to provide those and to document those. But because that explicit language doesn't exist, there's some inconsistency with payer policies on how they reimburse acupuncturists, and we want to improve the options for making sure that we're paid for all of the care that we provide and all of the documentation we're responsible for giving. And here, evaluation includes taking a history, examining the patient, and using that information to determine patient's course of treatment. It's an essential component of care and is required by the standard of care and must be documented in patients' records. And so we just want to be able to communicate that we're not asking for anything new. This is required of us now, but it's helpful if we have explicit language that refers to that. The second big emphasis this year is on office referral and order for diagnostic and clinical imaging and testing. And this amends the term that exists in statute, diagnostic techniques, that's described below, in the current statute, to include direct referral and ordering of diagnostic laboratory and imaging tests as warranted by the patient's health condition. And again, under current laws and rules, diagnostic techniques are techniques that are described as those that assist in acupuncture diagnosis, corroboration, and monitoring of a patient's treatment plan, or in making a determination to refer a patient to another healthcare provider. And as it reads now, it says that it's use of laboratory test findings, use of imaging, films, reports, and other test findings. And so we want to expand that to not just simply use of findings, but to clarify the gray area around ordering and referring for imaging and labs as part of our prescriptive rights in Chapter 457. This question of use of sterile injectables needs to be it needs to be improved as well. And acupuncturists are currently permitted to use sterile injectables. And the rule permitting it is, we're all familiar with the rule. This is for education purposes. The changes that we're proposing explicitly permit acupuncturists to order these solutions. Acupuncturists currently order and receive these products. However, the updated language is needed because some suppliers are reluctant to fill orders requests consistently for providers, including acupuncturists, who do not have explicit authority in the statute. And so the prescriptive rights that we're trying to make more clear, they're going to include, they're going to exclude at this time controlled substances, corticosteroids, antibiotics, vaccines, and Botox. So we want to make it clear in the statute that those 5 things are not something that would otherwise be interpreted as an injectable substance for acupuncturists. We want to stick as consistently as we can to the rule and demonstrate that all we're asking for is to create some more explicit authority in the statute that reflects practice as we know it here in Florida now. And so that's more or less what we're up to with updates to the Practice Act. And we really wanted to stick to things that were meaningful in terms of reimbursement for evaluation and management, clarifying AIT, and really streamlining the asks. And again, these are multi-year processes where we want to do a little bit now, and then we have other things that we probably would want on our wish list, but they don't really fit into the concepts for updating the Practice Act this year. Okay, I hope that's helpful in a nutshell. And if there's questions, I'll take that.
I know we have a question from Yagiz Ozkan. If you want to unmute and ask it.
Hi, you can call me Oz. I'm a foreigner doctor, which is moved to United States 2 years ago, and I'm currently studying in Atlantic Institute of Oriental Medicine. I'm in the first year, the 3rd semester in the Master of Acupuncture and Herbal Medicine program. So first of all, thank you for letting me to talk. And it's so important for me as a student being here and just talking to you and to say something about what I'm thinking, especially in the scope of practice, because for me and a couple of my friends from the students, like we are talking about it, and there is some kind of couple of missing points in the scope of practice. And I would like to say, I'm not representing the school, by the way. This is just me and a couple of friends' ideas and student friends. So but I just want to make it clear that like couple of, maybe for me the mistakes, sorry about the languages I'm speaking if something wrong in that point. But as David said, Mr. David said, like we can allow to diagnose. It's like not on the Western medicine purpose, but it's like some kind of the Western medicine tests we can order. For example, we can see the patient has a vitamin D deficiency but I'm not allowed to. This is on my knowledge. I'm not allowed to give the vitamin D shots on my scope of practice, but. Or I'm not allowed to practice in the intravenous treatments because it's according to my dean in the school. I asked that we are not getting educating for that. But especially in my school, we have tremendous, really good Western medicine education, which is I'm an osteopathic doctor in Europe. Like it's almost equal to our Western medicine, the education in the school training. It's like almost there. It's like we have really good biomed classes. So maybe after that program, we can get certain amount of CAUs, like even the nurse practitioners are doing that, then we can allow to add that things in our practice. Because it's, if we're going to take physician title, we have to offer our patients the complete treatment. Herbs are so effective. Acupuncture injections are so effective. I'm totally in with that. But the IV treatment is also in 2 points. It's going to create a huge benefits for us. First, maybe some of you know, like acupuncture education is not quite cheap. It's like around $60,000 to $70,000 only you are paying the school, and then by the time you separate from your school and all that stuff, it costs the double. So
Right.
these IV places, this IV treatment, if you get some certain amount of CAUs and at your practice, it's gonna bring so much income. But of course, we are not doing this for income. But it's
Yeah.
gonna help you to bring some income to your practice. And the
Thank you, guys.
second thing,
Let me unpack some of that for you because
yeah,
I appreciate the input, and it's discussion that we've had with the profession really for many years, probably more 15 years that I've been around. It's been part of the discussion. There's a couple of structural things that go along with what you're describing. There's an explicit prohibition on IV therapies that's included in the injection therapy rule, but where the Board of Acupuncture created that in 2002. And so here earlier, you might remember I said we're not asking for anything that's explicitly prohibited. That it is prohibited, but part of the reason it's prohibited is because it's not included in the entry-level training, and it's considered outside of the scope of practice for acupuncture. And there's a lot of reasons for that. And the concept of doing CEUs or certification programs to enhance the scope of practice, that doesn't exist in Florida because the Department of Health, when they issue a license, it's basically a silo of permitted or authorized acts, and either something is within the scope of practice or it's outside of the scope of practice. So we can't necessarily sort of stack, knowledge, skills, abilities, and certifications parallel to our license and saying, I've done my entry-level training here, but I've enhanced my training by going outside and having professional development in some other area, and then including that in our practice. And so what you're describing has to be brought into the entry-level program. It has to be approved through the academic approval for the AOM program, whether it's the master's or the doctoral program. And then so the cart has to stay, behind the horse at all times. We're not going to be able to do injection therapies without restructuring the entry-level program. And that is something that's sort of a...
You mean IV? You
Pardon?
mean IV therapy?
I
You mean
misspoke. IV
therapy.
therapies, thank you. And so it's a little outside of what's available to a discussion for the state association to work with the state legislature on an issue like that, because we really don't have the foundation in our practice. And so there are other methods for bringing IV therapies into one's business model, but it would involve using people who have both the prescriptive authority and the scope of practice to provide those services in a manner that fits into, that fits under their scope and fits into your business model. I agree with you. It's something that would be, ideally great, but there's really very little linkage, for us to get there. It's really, it's a system of medicine, or it's a procedure in medicine that exists parallel to what we do. And so structurally, there's just a lot to changing that. And it starts, like I say, it might start with ACOM. It might start, well outside of the Florida legislature and what the state association can do. But it's on the horizon, and it's something that's being discussed. And the only example I see that permits IV therapy in the country is New Mexico, but they have a separate structure for a two-tiered licensing system that does not exist in Florida. And Florida is not going to adopt a system that looks like that. And so they do have a two-tier licensure in New Mexico that allows for it with demonstration of additional training, but that nowhere else in the country does it exist. And so much of what we're looking at in terms of updates and improvements on our own statute is rooted in precedent. You have to be able to really point to successful examples of where this exists elsewhere.
For that one, if you got, I don't know, as a student, I'm eligible to do that, but I can have like a really good research from China to I can go and present that whichever place we need to present, and I can represent to the association to on that purpose, because in China, this combining is using in Thailand. I used to practice in Thailand
Yeah,
and China
no,
before I moved to
there's
the
no
United
doubt.
States.
I don't mean, yes, there's no
Yeah,
doubt that there's no doubt that it has a role and that there's a place and there's data to support it. I'm just saying that from a structural standpoint, we're just not set up to allow non-physicians who are unlicensed and untrained in part of their entry-level program in that way to bring those types of procedures into our scope of practice. In other words, it's in the purview of nursing and medicine to do that. It's not in the purview of the practice of acupuncture. As it's practiced here in the States now. But I'm going to take this conversation offline if I can with you, because I think you have a lot more to contribute to this, and I'd love to see the research and the data, and I'm willing to put energy into crafting an argument for how and why this is possible. But it's going to involve a lot of stakeholders kind of vertically from the profession outside of Florida to be able to do that. But I think your input would be really helpful. So if you don't mind, I want to give it back to Stuart and ask if there's any other
probably you
questions.
didn't remember me. We already talked about this in the FSOMA. So you are so busy on that time. Last year's FSOMA, I was there, and just you gave me we had a really good conversation around 30 minutes for that. So I'm open to talk about that even in the acupuncture injections. So in the nutritional injections, injection therapy, it can be expanded and it can be added more things, because it's we have a really good education in the school for doing that, and having a physician to helping the patient in every aspect. So, and just these therapies are super helpful when you combine two tests, which is we can allow to test, we can see the point, but we are not really allowed to completely treat because of the
And I think
restrictions.
you and I, and we have a lot of colleagues that would agree that there's benefits to everything you're describing. It's just, how do we get that under our roof? There's a lot of pieces to move to do that. So let's continue the conversation. Okay. Thanks, Stuart.
Thank you very much. Thank you, David. Yeah, there's a ton of moving pieces. As a registered pharmacist for the last 40 years, I can tell you that that's another moving piece why a lot of acupuncturists can't have access, because these are federal legend products and you have to put them kind of in a box and then negotiate what's in the box of your goodies, to be able to inject so a lot of moving pieces. Thank you very much, David. Any other comments that you would have for David? Anybody else? All right, let's move forward. Ellen, do you have that agenda? Can you put that agenda back up again for us? Thank you guys so much for contributing today. I know you guys are all very passionate about the legislative actions that are going on. We have an ASA bill currently, a Medicare bill currently going on. I know Galena has been very instrumental in the past years, and Dickie Wells as well, our membership committee chair, in watching ASA's actions. I'm going to share a screen really quick here for the presentation. So you can see here, I pulled this up. Can you see a graph of America here? So of the United States. So what I wanted to show you here is that the ones in red are the ASA's voting member states. The ones in light blue here are your non-voting states, and states without any member association, unfortunately, are all the gray identified states here. I want to bring your attention to, and this is from the asacu.org site, from the Member State Association of the American Society of Acupuncturists. When you go down here, I want to point your attention right here to watching the ASA and the NCCRM webinar, the 2025 strategy for acupuncture for our Seniors Act, because this is going in front of Congress again, hopefully this year, and really trying to press Congress to allow all acupuncturists to be enrolled underneath Medicare as providers. And if that occurs, to be able to literally bill Medicare for our services. So it's a big movement. I think we should all be watchful of what's going to happen here. And if you're asked if you get involved with ASA, FSOMA is part of the ASA grassroots associations. state associations. And if you want to get involved and you have a local federal congressman or senator that's near you, you will probably be tapped and asked to be part of that agenda to make them well known that you're here as one of their constituents and what the agenda for ASA is. So I just wanted to show you that. Let me get off that. Let's see if I can. Here we go. And get back to the agenda. Is Galena on? Galena, are you there? Are you
Yes,
on?
I'm here.
You want to make any other comments regarding the Medicare bill that you've had updates to?
Yes, it's very important for us. Don't contact our representatives or senators blindly, because we have like about 17 sponsors from Democratic side of the bill and only one Republican. So we don't want more Democrats on the bill, but we do want Republicans. That is very important for bill would be bipartisan, especially in the current Republican environment. So if you are interested in supporting grassroots, please contact the FSOMA and watch the town hall. There is a specific contact information for NCCOM lobbyists, and they can direct you and schedule an appointment with your Republican congressman. Thank you.
Thank you for that, Galena. Any questions that we can possibly try and field? I am definitely not an expert in ASA agendas, but any comments from any of the members that we can maybe answer regarding the Medicare bill coming up? No? Okay.
I'd
Well, I
like
want
to
to
make
thank
a
you.
point.
Oh, sure.
You know, I've heard different things, objections. Change is coming. People want acupuncture. The Medicare tried to put us in their rules so that we could, our definition of our training is in there. But the reason we can't provide directly and bill is because we're not in the Social Security statute, and it will change things. If we get in there, it will change things. You do not have to be a Medicare provider. You do not have to take Medicare, even if we're in the statute. But if we aren't in the statute and able to provide Medicare to Medicare patients, somebody down the block is going to do it. The PT is going to do it. A nurse practitioner is going to decide to take it on. Other people have co-opted acupuncture in spite of our best efforts. And they're going to be the ones in there. So if we're not in there, we're just going to be off the table or on the table being carved up, whatever you want to say. But, you know, we need to be able to provide and bill for Medicare to be part of that system. So I just wanted to
You
make
bring
that
up a good point, Ellen, for sure. And this is what this is not from me, but it was a very mindful comment that I heard from the advocacy committee chairman from the ASA, Jennifer, making it very clear. A lot of people have a lot of objections to wanting to be able to bill Medicare or Medicaid services and say, you know, why is that necessary? I'm a cash practice, or, you know, they'll refund or not the refund, but the payments from these sources are so low or it's not worth it. Let me just state two things that she said, which were very insightful. One is that we have two things to discuss and remember. One, whereas as a profession, the second one as a practice. These are different. The profession of acupuncture moving forward is one topic. The practice, your practice specifically of acupuncture, is a whole different issue. So I hear a lot of that about why do we need, all the way to, you know, and I don't want to get into a huge amount of a debate, but even with the entry-level doctorate degrees that were presented by ASA and moving forward, a lot of people is like, we don't need a doctorate. We're good practitioners. We're better than any of the doctorate trained programs. I get it. But you're talking about the practice. I want to talk about the profession. In order to move the profession forward, which it must move forward, the law of the universe is anything that doesn't change will ultimately compress and dissolve, evaporate. So in order to move forward, we have got to make advances in our profession. And this is, of course, coming from me, not specifically the attitude of the FSOMA board or the executive committee, but I do believe that our profession needs to advance. We need to be recognized as an allied health professional. Our practice is a whole different topic about how we get that patient into a more balanced state and what tools that we have to utilize. Two separate and distinct issues. So don't write off ASA's attempt to try and get Medicare and Medicare approval for us. I think it would be a big step forward in our recognition as a profession. That's the only comments I had. Any other comments?
Hi, how's everybody doing today?
Hi, Annette.
I have a question for you. My name is Annette. I am a second semester student at Dragon Rises. And I wanted to find out if there's anything that we as students can do to help any of this along. Like, would it help if we called the congressman? What can we do to help?
I'd like to take that if I can. I'm a membership chairman for FSOMA, and the most important thing you can do is go online to the ASA website and register as an ASA member. As a student in Florida, you are eligible for ASA. You are an ASA member because your school is a member. Through that, you're a member with FSOMA. And ASA has got a lot of great information about how you can help and who you can contact to find out who and how to best help. Our situation is Medicare would really like to cover acupuncture. They've made that clear by making it available for low back pain as an experiment to see how it works. We can negotiate a much better situation with them, but it literally takes an act of Congress before we can negotiate. Until we become accepted by Medicare as providers, and that is a congressional move, we can't negotiate. Once we get past that point, many things can change. The other thing that's very important is that other insurance companies will not cover us in many cases. I run into this all the time with patients who come in, they have Medicare coverage. They've been told that they have Medicare coverage, but they're only covered under the extent to which Medicare will cover it. And that means it's got to be someone other than us that provides it. So all of these things can improve and make life better for us. Please join ASA, go online and become a member, and they will help you with anything you need to know about how you can help in this drive.
Is that a separate, because I was under the impression that once we joined FSOMA, we were a member of ASA. Is there a separate membership that we all need to fill out? Because I do know that when Miss Ellen was at the school the other day, a bunch of my classmates did make sure that they were members of FSOMA, but I will tell them to take that extra step for ASA if we need to.
Please, you need to go on the ASA site and go into registration and register as a student member. This
Okay,
is
I
this
will
is the
make sure
way
that all my
we need to
classmates
get
do.
all students to do this. We've
Yeah.
been trying to get the word around on this. So we'll make sure that that word gets to the school and gets through the system and get everyone signed up. Thank you.
Absolutely. Thank you.
I think,
And if
Annette,
possible,
I think what I was gonna say real quick, what I think what Dickie's getting at is the membership, it has, you have a pass through in terms of the membership, but in order to be on the ASA listserv and to sort of get access to some of their training tools and legislative pieces that their talking points for Medicare, it's found there. It's found at ASA. And so I don't want you to feel like it's a separate membership. You have pass through benefits as a FSOMA member, but listserv communication with ASA is going to be done through their own platform.
Okay, I'll make sure when I go to class on Tuesday to let everybody, at least in my class, know, but then to also kind of spread the word amongst the schools so that we can get as many people signed up for ASA as possible.
I think it's also, if you want to sort of rally some troops, we can work with Ellen and myself or Dickie, and maybe we do a video version of the lunch and learn or something like this midday or in the evening, that we can gather everybody together and answer questions, and maybe do a group move to get everybody registered.
Okay, perfect. Thank you.
I
Right,
also
Glenn.
would like to add a point to all of the Medicare illusions. A lot of our profession is under impression that Medicare pays pennies, and simultaneously, a lot of acupuncturists in Florida take VA. VA pays Medicare rates. It's exactly the same payment right now. So it's not that little. For example, if you do usual and customary 2 units of acupuncture, it's $80 for electroacupuncture reimbursement for 23 minutes, what you need to spend. We just did the insurance committee survey. Average number of patients which people see in practice in Florida is 23 patients a week not taking insurance. It's not survivable. Just think about it. You can earn $80 for 20 minutes of your time. Multiply it by 3. The Medicare will provide for you a humongous number of patients. So that's one of the big reasons to join it, and it's employment. The most important, it's the future, it's employment. It even doesn't matter how much they pay at this moment.
Thank you,
Thank
Sabrina. Yeah, there's a oh my gosh, this topic can go on and on. You know, I am an advocate kind of researcher in my past years, but certainly there's a lot of driving force for reimbursement for insurance. Insurance companies covering acupuncture would want to see, is it viable? Is it viable to spend less than, say, $13,000 or $15,000 on a knee surgery, arthrotomy, or arthroscopy, when acupuncture does very well with knee pain, you know, for instance, for a couple of $1,000s. So it is being driven, research is driving reimbursement, and there are Medicare Plus programs that have already started covering acupuncture, whether it's 20 visits or 23 visits a year. So it's the world is shifting, and insurance is coming. Whether you want to jump on that bandwagon or not, that's an independent decision for your practice for sure. But to make sure that FSOMA is going to make sure that you know all of your options. Anyone else with any comments regarding that? All right, moving on. Do we have Cynthia Ann with us, the chair of the advocacy committee?
Yes.
All right, so Cynthia Ann is doing an amazing job for us with advocacy, shouting out the word, being a cheerleader out there. If you have any inkling that you are not even an introvert, but an extrovert in shouting out that acupuncture works and getting it out to both the public, she is the one to she is the one to see about getting on her committee. Would you mind spending just a moment telling everyone about the upcoming AcuEd Day? I want to just preface that with, there's 2 AcuEd Days that are coming your way, one from FSOMA. The other AcuEd Day is nationally. So if you want to get involved with going to Congress and being a participant in Washington, D.C., that will occur the 28th of April. So the ASA annual meeting is going to be the 25th of April to the 27th of April. On that Monday, the 28th, there's going to be a delegation that is going to the Capitol and providing acupuncture to those that would love to receive that type of treatment. And it gives us an opportunity for sure as acupuncturists to demonstrate, you know, remove all the myths and misconceptions about acupuncture for sure, at least try to do that and give them a treatment. But Cynthia Ann, can you tell us about FSOMA's activities?
Yes. So for our advocacy committee, our biggest event of the year is AcuEd Day. That is happening March 11th. There's 2 branches of it. One is a treatment team, which is led by advocacy. And the other part is David's legislative team. So there are 2 teams that you could be on if you're interested in participating. This is our opportunity to speak to our legislators in person. It's also our opportunity to share what it is that we do with the general public and the legislators that are there in Tallahassee on the 11th of March. If anybody is interested in being a part of it, please contact either advocacy for the treatment team or David for the legislative team. But we'd love to have you guys there. The other things that we're doing with advocacy, we're also doing a radio campaign, which involves interviews and sharing different aspects of acupuncture so that people realize that acupuncture is not just the tool of using a needle, but a whole health-centered treatment. And I want a little diversity in the way that people hear about acupuncture. Some people practice acupuncture and they just do needlework. Other people prefer to use herbs. Other people prefer to use every tool that they have in their cabinet and take everything out. And we do have a lot of opportunities this year to do very brief 8 to 10 minute interviews. And we're trying to work with the CEU committee and journalism committee to have each month be something that is a national campaign and have a more focused outreach through multiple aspects, including our membership committee. So if there's anything that you would like to do to reach out to your community, reach out to people to let them know about the kinds of ways that you practice medicine and how that Eastern medicine is a whole person-centered care, advocacy might be a good place for you to be. And I really do like a lot of looking forward to having some more speakers available, people who really like to share passion. And I have been going to the National ASA conference for the past 3 years. That is in April, the 26th through 28th. And that's a fabulous opportunity to meet other acupuncturists from around the United States. I wouldn't miss it for the world. I'm going to participate again this year at Capitol Hill on the 28th with that outreach as well. So if there's anybody who would like to join, please let us know.
What's the best way to get a hold of you, Cynthia? And I mean, through the website, Ellen's been scrolling, looks like.
Through the FSOMA website, you can contact me directly, Cynthia Ann H. FSOMA@gmail.com.
Okay, very good. Any comments or any questions from the membership about AcuEd Day or what we're doing in that regard? Okay, thank you so much for that that insightful, education. So I hope everyone has the opportunity to at least participate one time. We do our best. If it is a far venture up into the Tallahassee area, for sure, to have this happen. And FSOMA does support all of our volunteers, taking care of their meals and travel extent. So I really appreciate anyone that would join Cynthia Ann in this venture. I also want to make sure that in going forward, Ellen, we are receiving conference registrations for our annual conference coming up. Is that up and rolling? So
yes,
I want you to talk just briefly about that, about how people can register for our conference coming up and what we have going on there.
Well, this is the homepage for the conference, and it's FSOMA.org 2025, and all these links take you places. It's going to be back in Fort Lauderdale at the Westin Fort Lauderdale Beach Resort. Here is the schedule at a glance. And we don't have any sponsors yet, but they're getting there. But you can come here and see the teachers, the classes. You can, up at the top of the page, you can actually get more detail on the speakers. These are the speakers we're having this year. And we've got a description of their classes, about the speaker. If you haven't been to the conference, it's a great event. This is the registration page. It just will give you the pricing. Early bird is through June 1st. So you can come here and see the prices for members, non-members, the savings on the conference plus the savings on member benefits. You can, if you're not a member, you can pretty much make up your membership on the savings on CEUs. And there's nothing more fun than hanging out with your friends at the conference. So that's an overview. Any questions about the conference?
There's a lot of excitement this year with the conference coming up. We have already a lot of great support. We've always had great support from our vendors. We're actually having discussions about room, which is always a good discussion to have about how we're going to try and put in all of these people that want to show their products or their services. So I'm really excited this year about the conference being jam-packed. A room full of excited people and members to get a chance to meet. I can't tell you how, I can give you just my testimonial as an acupuncturist back in the days. I really never thought that I really needed FSOMA. And, the problem with that is that I thought I was on my own little island, and whatever I did really didn't impact anyone else. And yes, I heard about FSOMA, I heard about a membership organization, but I'm doing okay. And I am, nose to the grind wheel, so to speak. But I never in a million years, once I got involved in FSOMA, recognized how important it was for me to be a member. And I appreciate you guys being on the call today, because you probably have the same instincts that, is there more for me outside of my practice? And you can see by our legislative talk, by insurance talk, that these factors will affect us in the future. It is no doubt. And by being a member, it really pushes you to that next level about being concerned about things outside of your purview as a private practice. I want to make a challenge to you, each and every one of you listening to me, that the only way that FSOMA will thrive and survive going forward is if we grow. And my agenda this year has always been in membership, always has been membership. And I know that there's strength in numbers. When I look at some of our allied health practitioners, like the chiropractic profession, the massage therapy profession, I see that a majority of the licensed practitioners are members of their state association. I think we're still hanging down around, I could be a little bit off, about 18% or 17% of the total licensed acupuncturists in this state are members of FSOMA. So my challenge to you is that you have one person, I know you have one person that you're in contact with that probably is not a FSOMA member, whether that's a colleague practicing down the street. I've always said I don't think we're competition at all. I don't think there's enough of us to heal this world, especially our local world here in Florida, that you contact them and as a member say, listen, some of these are some of the benefits that I've had. Give your own testimonial of being a member of FSOMA, able to be kept updated. I make a difference. I make sure that my profession, and take it on personally, my profession is going to grow forward and thrive. And I'd like you to help me in that vision to try and bring a member in. If every single one of us, as Dickie Walls said to me not too long ago, if every single one of us is able to bring in just one more member, one acupuncture member, we will double our population overnight. So I ask that you consider that you start thinking about that this week, about who you can ask. And if you get a negative on the first one, do not give up, because after every no, guess what there is? There's a yes somewhere down the road. So any comments or questions relating to membership or what we discussed? I want to open it up here.
Just remind them it's just over $5 a week, just a little bit more than $20 a month to support the profession.
Yeah, it's so important. Thank you, David. That's a good way to post it as well.
Could we possibly have a challenge for whoever brings in the most new members gets 25% off their membership renewal or something like that?
Well, we actually do have a contest we're building. First prize would be a free conference. There'll be maybe second, third, and fourth prizes of gifts from exhibitors, from business members. So we haven't launched that yet, but it's in the works.
Awesome.
And each person you recruit gives you another entry into I guess you would call it a raffle. You get an entry into the raffle to win something. So
Fantastic.
Katrina, I can tell you're going to be a winner. Because it shows interest. Thank you very much.
Not a problem.
We're open, folks, for the next couple of minutes. We got just a couple of minutes left. Any final comments or any final questions for the board, for any of us here that you'd like to bring up? All right. Thank you very much. Well, I'd like to all thank you as closing remarks. All thank you for attending today's session, the town hall. We've scheduled an additional town hall meeting this year. Ellen, unless you have that on the top of your head, I don't have the date in front of me, but it will be after the legislative session ends, probably sometime in August. And that will be the update to how did we do this year, what new potentially challenges we'll have for the rest of the year, if not the next coming year. Remember that legislative actions, this isn't just a one-year event. This has been in the process for multiple years. David's been working on this and staying busy for many years. And if this goes through, it's going to be amazing. We still got a lot of work to do. If this does not go through, we still have a lot of work to do. I will make this as a final call. We need support, either your support in time and energy and helping us out on the board, or your financial support. You guys have been awesome in donating to FSOMA. Hopefully we'll have at the conference another raffle where someone can really win some big prizes. We're working with fundraising in a lot of neat ways as well to raise funds for FSOMA for our PAC funding. And if you have any, like I said, any amount is definitely appreciated into the PAC fund so that we can keep this process moving forward for you guys. Any additional comments from the board before we end?
Excellent, Stuart. Thank you so much.
Thank you so
you.
much, guys. Yeah, thank you so much for
Thank you.
attending the town meeting, and we will see you soon on the FSOMA website. I look forward to meeting all of you on a committee and signing out. Dr. Stuart Scheib. Thanks a lot, guys, for
All
attending.
right. Bye-bye.